monkeypox. As we are aware, WHO has declared it as public health emergency of international concern. Ghana has so far recorded about 34 cases. The last confirmed case was on the 15th of July. After the last breakdown, we had about, of the 30, we had the first 30, we had about 20 of them from Greater Accra. We have one in Bono East, Bono, Upper West, and Ashanti region. So these are the regions who are reporting cases. So far, no fatality among cases have been reported, and the majority of the cases are males. So you can see with a chart, the map showing where the cases really are. We have them in Upper West, Bono East, Bono, Ashanti, Eastern, and Greater Accra. Greater Accra accounting for about 2/3 of all the cases that has been reported. So district rapid teams, as usual, and case management teams have been oriented on how to identify and make a response. We have also disseminated WHO guidelines on case management and how to do when you have a case of monkeypox. We are working with the Veterinary Services Department to conduct assessment in affected communities to look for what are the possible causes so that we can identify possible contacts and those at risk and protect them. Contact tracing and follow-up, and we have enhanced education in schools and communities as far as monkeypox is concerned. Very easy to mix it up with chickenpox, and I think so education is extremely important. So what is the outlook for us? The public health system is currently being strained and stressed with all this emergency that is coming up. But I must say that the system is holding, and thanks to the community and the system that are in place, is happening. I think the only trump card, the main trump card we have here is the fact that the system is able to pick up things very, very early than, and I think we may have picked the first monkeypox even before the announcement became a public health emergency as we saw. The risk of widespread monkeypox exists but has not posed a major threat. The threat of Marburg virus that will spread exists but is very low. The chance that it will spread is low because we've done since the 26th of June up to now. If it was going to be an explosion, well, we should start seeing a spread from those initial contacts who may have passed it on to others. But like I said, the risk is there. The host is in the country, and so the possibility that it can be jumped into anybody is important. So we continue to be on the lookout for that. So to look at that is to prevent all that is adherence to protocol is extremely important, and infection prevention and control strategies, including personal hygiene. Marburg is a close contact. If you don't come in touch with flu, body flu, etc., you won't get it. And so how do we look at that? And we must also commend our health workers in the fact that when they encounter the case, because of the infection prevention approaches they have, so far we've not had any health worker who has been affected. Usually, such cases is the case, and the next batch of people who makes affected are the health workers, the first responders who are going to look at them. But in this case, we have so far not had any condition appearing from them. The surveillance activities will continue to be strengthened so that we can make sure that early detection and adequate containment is ensured. So thank you very much, Mr. Paul.